Okay, do you have health insurance?
Yes.
For who?
My job here at the school, the Dexter School Districts, they provide health insurance for all their employees.
Okay, do you know how many Americans do not have health insurance?
Over 40 million, I think.
47 million. That's 20% of the population.
20%. That's a lot. That is a lot.
And are you for Obama's health plan?
I think we need to make some changes in our health insurance. I'm not really sure what Obama's plan is, so I can't really say if I'm for his plan or not until I get to read about it. But we've got problems with our health insurance,
Okay.
so I think we need to make some changes.
Okay, well, I have a passage that Obama stated, so I want to know if you agree with it. Okay. He said, I suffer no illusions that this will not be an easy process. It will be hard. But I also know that nearly a century after Teddy Roosevelt first called for reform, our economy and the sustenance for our nation long enough. So let there be no doubt, health care reform cannot wait. It must not wait, and it will not wait. Do you agree with that?
I think we need to make changes. You know,
Okay.
and it's, I'll tell you something that my doctor told me just last week. My husband and I went with my husband to the doctor. He had a place on his hand that we couldn't get healed up. So the doctor decided he needed to cut it open and look and see if there was something inside or if it was a skin cancer. So while he was working on my husband, we were just sitting there talking, and he said that with our copay, we usually pay $25 when we go to the doctor. With what we were paying and what the insurance would pay him, he would end up getting about $75,
Wow.
which is not very much money because it took a process that took well over 30 minutes for him to, and he has, you know, his rent and his electricity and his nurses and his supplies, and, you know, for that much time, he was going to get $75.
Wow.
So he said, he sent us to a dermatologist who's a specialist in working with the skin. If we would have gone to a dermatologist, our insurance would pay the dermatologist $1,000
Wow.
for doing the very same thing. So he says it's not really worth his time. But he did it because we were patients of his and it was more convenient for us, so he did it. But there's a lot of unfairness that way with the insurance companies. So, you know, there needs to be some kind of regulations. The government, the insurance needs to be fixed. I don't know what the answer is, though. I don't know how you fix it, and I'll just have to read with the plans that they come up with to know if I support them or not.
Okay.
Do you think we should have free healthcare? Just like they do in like Canada? and
Well,
places
I
like
don't
that?
think there's any, it's not going to be actually free, I don't think, because it'll be paid with taxes.
Yeah.
Our taxes.
But do
So
you think
Yeah.
that would work out better?
it could possibly, I don't know. As I say, it's hard for me to decide without actually reading about it, but, you know, the whole tax issue is a whole nother issue, so I have strong feelings about the taxes as well. But, you know, I don't know. I don't know how free would work. I'd have to read about it and see what the actual plan was to know what I think about that.
It's crazy.
It is. It's sad, and expenses just keep going up, and my husband's thinking about retiring, and it scares me to death to think, how are we going to pay for your insurance if, you know, he's not working at the Dexter School and having it as part of his benefit plan.
Huh.
Well, I think that's about it. So.
All right.
Hang on a second, replay. Alright, go.
Okay. How was insurance when your kids were growing up for you guys?
Okay, it was kind of different when my children were small, and they are now, the youngest one's 25. So when they were small, our insurance basically just paid whenever you were in the hospital or you had to have special tests done. When I took them to the doctor, it cost $40, and that was it, just for a normal office going to the doctor. They didn't file the insurance claim. We went to get prescriptions, and we actually paid for the prescriptions. It wasn't like you paid $10 or $30, you know, and the insurance paid the rest. We paid the full
Like a
price.
spin down.
But the most expensive prescription I can ever remember, and you know, this was back in the 1980s, one time was $50 for an antibiotic, and that was all the entire cost. Now, some of the prescriptions that my husband takes, they're like $250, $300 for 1 month's supply. So now we just pay a small, like $30 or $50 for a prescription for a month. Same as we were paying back in the 1980s, but the prescriptions cost a whole lot more and the insurance is paying for the rest.
What do you think about Medicare, Medicaid, those type of things that you give you free health coverage for children and stuff?
Right. The Medicaid is one, I think that's the one that's based on income.
Yeah.
Yeah. So, you know, those people, they need help with the insurance because there's no way they can afford to pay for insurance themselves. I just read on the internet a while ago, of course you can read anything on the internet, but a while ago before you all came in, I was kind of reading about the health care. And it said that like 1 million people a year are losing their homes and filing bankruptcy.
I researched that too.
Because they can't pay their health care bills.
Yeah. And there's going to be a lot more to lose their house by 2016.
That is sad, you know, that many people that is filing bankruptcy or losing their homes due to not being able to pay medical bills.
Yeah.
So, you know, we need help. I think
really
the health
have
care
had-
should be for everybody, and we just need to find a way to make that happen that will work for us. So.
There's really insurance on everything. You got cars, house, health, everything.
That's correct. That's correct.
And you have to have it on every little piece.
So the insurance really has changed since, you know, I first got married and realized what insurance was, and because I had to pay for it myself. And then when we got jobs, that was part of our job, is they paid our health care insurance, but it wasn't anything that we ever used unless we were in the hospital or had to have tests or something done. And this insurance paying every time you go to the doctor and every time you get a prescription has happened, you know, since the 1980s.
Do you remember any of when you were a child and how your parents had to pay for health care, or?
No, I'm sure it was through their jobs as well, but I don't really remember. Of course, whenever I was little, when the doctor used to come to my house when I was sick. He said he didn't want all those sick kids in the doctor's office. He said, I'll come see you instead. So he would actually come to our house. So things were kind
That'd be nice.
of a lot different back when I was a child.
Yeah, I would love to have a doctor come see me
And,
at
So
home.
I can get out.
I wouldn't have to get out. Most of the time I just go to the doctor in PJs. My granny used to get on me all the time. That ain't proper for you to be going to the doctor in pajama pants. You need to have some pants on.
I don't know.
Is that it?
I guess.
That's it.